This is Ray from Barod in Swansea. I'm currently with Caroline Phipps, CEO of Barods, talking about the current effects of the coronavirus. So, Caroline, how is the coronavirus currently affecting Barods?
Well, I mean, I think that, first of all, we're just part of a bigger community. I mean, it's affecting us all. You know, you and I just spoke. Have we ever experienced anything like this before? And the answer is no, not in my lifetime. The last time that we had a pandemic, from what I understand, was way back in 1918. And of course, our world is so connected that, you know, this pandemic has spread really quickly and it's really frightening for people. And I guess that us as in Barod, we have a responsibility really to safeguard the health and well-being of our staff and our service users. And the way that we're doing that really is just following the most up-to-date guidance from UK, Welsh Government and Public Health and our health services. We want to do our part in sort of minimising the risk of transmission, whichever way that we can. But also, really, really importantly, is to continue to provide a service to some of those, you know, the people who need it, and prioritised by sort of risk and needs. And we want to maintain service provision for as long as possible. So, notwithstanding some of the things that we've implemented today, which I'll sort of explain, in terms of keeping staff safe and avoiding transmission, we want to ensure that we have some sort of delivery for a length of time, because we don't really know how long this is going to go on for. And I think what has been really important, and I suppose important for me as a chief exec, is to communicate clearly and timely with everybody, and work with other partners collaboratively. We're so connected with other services that, you know, we can't change things in isolation. There has to be a collaborative approach. And that's been really important. We've been holding sort of daily meetings with our partners and senior managers, and then keeping our stakeholders informed, commissioners and the like, who need to know about what we're providing. And I think what we do is it's a dynamic situation. We may not always get it right, but we'll make the decisions based on what's the best information at that time.
Advice-wise, how can service users best protect themselves at this moment in time?
So the main things is us all, you know. We're all vulnerable to this. Our service users, I feel, are particularly vulnerable and at risk, and I'll explain a little bit why. But the measures that we should all be taking is we should be washing our hands frequently for 20 seconds. There's lots of different songs that you can sing whilst you're doing it. I Will Survive, Happy Birthday, whatever you like to sing, you know. And I was always taught that a second is the same time as you say one elephant. So I got from one elephant to 20 elephants. So then I know that I've actually done it for 20 seconds. You know, we've got as much hand sanitizer here as is possible, you know, in the buildings. Obviously, for our service users, they may A, not be able to afford it, and B, not be able to get it. So simple soap and water is something that they can use, and that's really important. When people sneeze, it's about sneezing, it's covering one's mouth, sneezing into, if they haven't got a tissue, which is the most important thing, you sneeze it into a tissue, then you bin it. But if not, you sneeze it into your elbow. So it avoids the sort of, you know, there's the tiny droplets that comes out when you sneeze or when you cough. They come out and they can sort of, you know, they can throw those droplets quite a distance away, and if they land on you and you've got the virus, that could infect it. So those preventative things are for everybody to do. If we've got a temperature again, and any symptoms in terms of coughing, then we'd be asking people to self-isolate. That's what we're doing in terms of our staff. Now, we recognise it's not going to be easy for some of the people who use our services to do that. It's not going to be easy for people to maintain the levels of hygiene that we're asking people to do. I mean, I've never been so clean in my life, but I'm lucky I've got access to, soap and water and hand sanitizer galore, really. But, we're asking people to do things where they may not have things in place. So what we kind of do is getting people who use our service to encourage them to think about how they can do that, what's the best way they can do that. How, if they were asked to self-isolate, how could they do that? And sometimes it may be impossible. So we need to help them look at if there's family around, how they could do that. And also, I think that the most important thing that we can do for people who use our service is to give them accurate advice as we know it. Because often maybe they, haven't read the paper or haven't had a TV and are maybe getting information via social media, which may or may not be accurate. That we can, give, clear advice and guidance based on what the people in authority are telling us.
Excellent. Last but not least, at this time, what sort of the key kind of harm reduction messages we'd like to pass on to our service users?
Yeah, I mean, this is really important, Ray, and we're so busy trying to do this sort of business continuity and planning and who's going to be in the office and who's not going to be in. And just for us to say we're going to be keeping as much of our service open as we can, particularly needle exchange. There may be some telephone calls and no groups or anything like that, but certainly we're going to be keeping in touch with people. So once we've sort of established that, so what are the messages for our, the particular people that we're seeing who may have poor health, may have underlying conditions like conditions that affect the lungs, and maybe more vulnerable, may have autoimmune things that make them more susceptible to infection. So simple things around trying to be as healthy as you can. Again, I know it's not really easy for our client group to do that, but all those messages are important. But I guess if you're using drugs regularly, then there are some things that you can do, or you can certainly try and do to make yourself a little bit safer. So that, again, minimising sharing your supplies, minimising contact. Now, I know it's quite difficult if you're a sex worker, but, activities like coughing or intimate kissing and that kind of thing, and direct contact with bodily fluids does expose you. So if there's anything you can do to minimise that, then that would be good. Prepare the drugs that you're taking yourself. Don't let other people prepare them, so that you know that you're preparing them. And keep your surfaces clean when you're preparing them if you possibly can. And plan and prepare for overdose, like making sure you've got naloxone, making sure that you're able to access, you're able to get that, and you can get that from our needle exchanges. We're open, we continue to be open. Again, washing your hands. If you're sick or if you're poorly, please try and avoid as much of social distancing as much as you can. That's a key issue for avoiding the transmission of COVID-19. And then we'd say stock up on supplies, stock up on drugs if you can. And actually what we're sort of looking to the future with all the travel and movement through countries being disrupted, extensively, if not, whole airlines and travel grounded, we may well be seeing a shortage of drugs very near and very soon. So we'll need to manage that as we hear of that and we get information. We're going to be keeping lots of information on our websites and social media, so please look out for that. Yes, and keep yourself safe as possible. We will be communicating, like I say, to people who use our service on a regular basis to let them know any changes and what they can expect and any new information that we have.
Caroline, thank you for today. If anyone wants to ask any questions or needs any advice, you can visit the website www.barod.cymru. The Swansea office you can contact, which is 01792 472 002, or be sure to visit our Facebook page. Thank you very much.